Today we're going to talk about multidisciplinary conferences, which are traditionally held at a site or sites in real life and can include a variety of medical professionals, including medical oncologists, radiation oncologists, surgeons, radiologists, pathologists, and often interventionists, depending on the cancer type. There are limitations to in real life multidisciplinary conferences, especially when they're being done at a rural or satellite clinics with limited capabilities, or when talking about more rare tumor types in which small centers may not have many cases. So one of the pain points for multidisciplinary conferences can be timing and scheduling. And I'd like to introduce Dr. Nick Weber, who is a surgeon and a specialist in sarcoma at Aurora Healthcare.
Okay, so yes, in real life, one of the problems is timing and scheduling with a multidisciplinary conference. In the sarcoma conference that I specifically work with, we are at about 4 different institutions, all of which are in different time zones, and we do this early in the morning. So trying to schedule IT guys to be able to make sure that all of our images and our pathology is there on time and at the same spot is very difficult, and I think that is our main problem, and that has been our main problem in the 3 years that we've been doing this particular conference. That being said, we have 3 institutions, each of which have 10 different specialists that show up, and it's difficult to coordinate all the locations that we go to and be able to have that in one conference room. So I do think that's one of the major problems for us.
I'd also like to point out that Dr. Weber and colleagues had an ASCO abstract called a Model for Multi-Institutional Multidisciplinary Sarcoma Video Conferencing, which was at the ASCO 2013 meeting, abstract 10521. And even though there are issues with this, I think that they have really been at the forefront of developing models to try to get around sharing information with rare tumors. There are a number of groups, often only in one institution, that are developing technologies and techniques for sharing case images and files. And I think there's a great need for this, especially with an aging population and with increased geographic dispersion with health systems. So one potential thing that can be done is you can have local conferences with just the people that can arrive there. What Dr. Weber has done is try to branch out to other institutions, but with some limitations on what time that can be scheduled. Another way of doing it that's being developed is an asynchronous model where you can upload the case information, pathology, radiology in a secure cloud-based format and then share that with people over time, in which case sometimes experts can come in at different points in time when it's convenient for them, and that information can be shared. This can be done in parallel to a real-life, local, or video-based conference, and also can be done throughout the country, or as some places are doing it, they're doing it even in different countries as outreach to Africa or Haiti. There's a group I know it's doing it with UCSF called Trinity, and they're doing it locally at UCSF as well as in other countries, and Best Doctors has also been working on this as well. Asynchronous cloud-based platforms may be a potential solution to share case images, files, and to connect people that are in different areas and potentially in different time zones. I'm Mike Thompson, and thank Nick Weber for joining us on this conversation.
My pleasure.
Tools like Medting, powered by Best Doctors, can help negate the scheduling conflicts often associated with traditional multidisciplinary conferences. Visit bestdoctors.com/medting or call 855-361-3800 to learn more about Medting or to schedule a demonstration.